Hello, my name is Dr. Akanbi Bolanle. I am a veterinarian and I am also a One Health enthusiast. I'm a member of the One Health in Action initiative. So today I'll be talking on important aspects of One Health that needs the focus of One Health stakeholders, mainly the human health doctors and the veterinary professionals, and how they can collaborate and mitigate disease spread. So before then, I'd like to tell you what the One Health is about. So One Health is an interdisciplinary approach that recognizes the interconnectedness of human health, animal health, and the environment. It emphasizes the collaboration between the human health, the veterinary professionals to address complex health challenges. So there's this thing they call the One Health approach. So the One Health approach generally involves the collaboration of multiple sectors from the human, animal, and environment health towards the prevention and control of diseases and other related challenges. It is simply the recognition of the interconnectedness of humans, animals, wildlife, and plants with their shared environment. So before I dive right into what the human health medics do in collaboration with veterinarians, I would like to mention other sectors that are involved in One Health approach. But before then, there are some health threatening issues that always requires the One Health approach. Some of them, amongst a few, is we have emerging diseases, we have endemic diseases, we have re-emerging diseases such as COVID-19, Lassa fever, monkeypox, rabies. Other things that require the health approach, the One Health approach, is food safety, antimicrobial resistance, vector-borne diseases, and even the neglected tropical diseases. So in order to manage global and transnational health threats at the human, animal, and environmental interface, there needs to be a multi-sectoral One Health approach. It is very essential. So some of the some of the other professionals that could help in the One Health approach include the doctors, the nurses, the public health professionals, the epidemiologists, the veterinarians, the paraprofessionals, the agricultural workers, we have the ecologists, we have the wildlife experts, we have the law enforcement workers, we have the policymakers, we have communities, as well as people who own pets. So we have pet owners. So now I'm going to tell you how the human health professionals and veterinary professionals can collaborate and what they should focus on. So number one is zoonotic disease surveillance and control. So zoonotic diseases are infections that can be transmitted between animals and humans. An example is rabies. Rabies can be transmitted from dogs to humans. For people that keep pets, they should always know about rabies, because if they don't properly vaccinate their animals annually, their dogs could come down with rabies if exposed to a stray dog that already has rabies, and at the end of the day they could transmit the rabies to humans, which could eventually lead to death. So One Health stakeholders should prioritize surveillance and control efforts to prevent and respond to zoonotic diseases promptly. So this requires collaboration between the human health and veterinary professionals to share data, conduct investigations, and implement integrated disease monitoring system. Another one is antimicrobial resistance. So antimicrobial resistance is a global health threat affecting both humans and animals. Nowadays, we have noticed that people without proper testing, they just take antibiotics without even knowing if this disease they are taking this drug for is actually what it is. They don't even know if it's a drug that needs the antibiotics, if it's a drug that needs antifungal. Sometimes they just take antibiotics without thinking it through. So One Health stakeholders must work together to promote responsible antibiotic use in both human healthcare and veterinary medicine. This collaboration can involve sharing best practices, implementing antimicrobial stewardship programs, and conducting joint research on the emergence and the spread of antibiotic resistance pathogens. Another one is the environmental health. So, One Health recognizes the impact of environmental factors on humans and the animal health. So, stakeholders should collaborate to address environmental issues such as pollution, climate change, and as well as habitat destruction. This may involve joint research projects, advocacy for sustainable practices, and development of policies that promote environmental conservation and protection. So I've noticed that nowadays there are a lot of people who want to advocate on climate change. They want to talk about waste pollution. They want to talk about proper recycling. So human human health professionals and veterinary professionals can help to join this collaboration, foster it, and make sure that people are utilizing these advocacies, not just doing it without practicing it. Another one is education and training. So the human health and veterinary professionals should collaborate to enhance education and training programs that promote the One Health approach. Remember, I said One Health approach is the collaboration of the human health, animal health, and the environment, so as to prevent the spread of diseases and maybe ensure that we live a longer life. This can include joint workshops, conferences, and academic courses that emphasize on the interdisciplinary learning and foster collaboration between different healthcare sectors. So another one is outcome preparedness and response. So One Health stakeholders should work together to improve preparedness and response mechanism for disease outbreak. Okay, let's say we have a disease like Lassa fever. Once we hear about Lassa fever, we should prepare. We should be ready with our resources to work together to stop the spread of this disease from a place where it's already endemic to a place where it's not endemic, so that it doesn't cause a situation where we could not control. I always like to use coronavirus as an example where during the COVID-19, I'm sure for most veterinarians, we were taught on coronavirus, but at that time, we did not know the so much importance of coronavirus, where we would have done more advocacy, or where we would have been more prepared for what is coming. We would have collaborated more with human health medics, talk to them that they could be coronavirus and how people can do this, use their face mask, use their sanitizers. We would have been more prepared to respond to it, and it wouldn't have caused the pandemic. So for the outbreak preparedness and response, it involves joint planning, simulation exercises, and coordinated communications between human health and veterinary professionals. This collaboration can also extend to sharing resources during emergencies, such as diagnostic tools, yes, vaccines, yes. During the COVID-19, I remember they started sharing, there was enough vaccine in circulation for people to take, so that if you have not come down with it, you're not showing signs, you take the vaccine and you prevent yourself, as well as medical personnel. We also have the research and innovation. Collaborative research is vital for advancing One Health principles. For me as a veterinarian, I would like to do more research with human medics, so that if there's any reported case of maybe an infectious disease such as cholera, I could come in and also advise on what they could do, partake in researches to help mitigate the spread of cholera. So human health and veterinary professionals can collaborate on research projects that explore shared health concerns, develop diagnostic tools, investigate emerging disease, and also study the impact of environmental factors on health outcomes. So before I wrap it up, Thank you so much for listening and watching up till now. I would like to give you a generalized health framework for the control of zoonotic disease. So for the human and veterinary professionals, there could be there could be 5 ways where we could coordinate the spread of zoonotic diseases as well as even other diseases. We have engagement, we have assessment, we have planning, and we have implementation. We also have monitoring and evaluation. So for engagement, it simply involves the establishing of one health interest by identifying and engaging these stakeholders, these professionals, engaging them from these relevant sectors, identify them and engage them. It is necessary for these stakeholders that represent this interest to start early because it will build trust and also improve sustainability. Another one is the assessment. Assessment simply involves mapping out an infrastructure, establishing baseline, conducting gap analysis, as well as completing economic assessment. Another one is planning. So for you to have a sustainable One Health approach between the human health and veterinary professionals, planning is necessary. So you need to be strategic in your planning. You need to plan, develop action plans for priority diseases. So these action plans can identify short-term activities while the strategic plans can identify the long-term activities. Another one is implementation. It simply means soliciting, acquiring, and allocating resources, implementing plans, protocols, and procedures, also budgeted, and also make room for finance plan flows so that when you establish your One Health approach, you begin implementation regardless of whatever might be holding you. You do not want the financial aspect holding you when you have all the resources. Lastly, you do a monitoring and evaluation. So you prepare a framework for monitoring and evaluation of One Health systems, which can provide evidence to support whatever decision you might be making. So finally, when these stakeholders collaborate, it can help in these following ways. It can help to prevent outbreak of diseases. It helps save costs. It improves food safety. It helps to reduce antibiotic resistance or antimicrobial resistance, and it also protects the global health security. So leaving you on a lighter note, to facilitate the collaboration, to, to facilitate this collaboration, stakeholders can establish formal partnerships and networks that bring together professionals from the human and veterinary fields, and this partnership can promote regular communication, knowledge sharing, and joint decision making. Additionally, funding agencies and policymakers should support interdisciplinary research initiative and provide resources to facilitate collaborative efforts. So by actively engaging in this aspect and promoting collaboration, human health and veterinary professionals, it can make a significant progress in improving the health outcomes for both humans and animals while ensuring that there's sustainability in our ecosystem. So I would like to appreciate everyone for listening, and I hope that you've not forgotten that the One Health approach can help to save lives, as it is the interconnection between the human health, the environmental health, and their shared environment, and the human professionals and veterinary professionals can go a long way in collaborating to help prevent diseases and also help keep the global health security in check. Thank you for listening. Till next time, I remain my humble self, Akanbi Bolanle, a veterinarian and a One Health enthusiast. Bye.